from the News Channel 5 network. This is Titans Tuesday.
We are Titans Tuesday, and we're happy to welcome you in on this Tuesday night. The weather's a little bit inclement out there. Hey, it could be worse, though, couldn't it? Thank goodness that things kind of calmed down a little bit from last night and early this morning. I'm not up early enough in the morning to get out and fight that icy battle at 6, 7, or 8 o'clock in the morning, and thank goodness I'm not. But for those of you that were, I did have sympathy for you, and I thought about you, and I hope that your day went well after that. I'm Hope Hines. Welcome in Titans Tuesday. What do we do on Titans Tuesday? We do a lot of things. First of all, we will hear from Dr. Dovan, who is here on behalf of Baptist Sports Medicine, and his specialty is in the area of the hands, and so he's an orthopedic surgeon, and we'll be talking to him. We'll talk to him about Albert Haynesworth's ACL and what's going on with that, and may even say a word or two about Kyle Vanden Bosch and some other injuries around the league happening. He will be up. First of all, let's say hello to Dr. Tom Dovan from Baptist Sports Medicine. Doctor, how are you, sir?
I'm doing fine, Hope. Thank you.
Now, you were scheduled to be on one night many weeks ago, and we had to substitute for you because of why?
We were taking care of one of the injured players. I was assisting in that.
That was Mr. King.
Uh-huh.
And what was the injury?
He had a forearm injury.
Okay.
So.
Forearm, now where? Would that be here,
This
elbow?
is the forearm, yeah.
And what happens in a forearm injury, or his injury specifically?
Typically in the forearm, you break it. That's a typical
break that
injury in
big
the forearm.
bone here?
You break both bones in the forearm.
Wow. Now you have, that's like, they run kind of like.
They run parallel right down the arm.
Yeah, and so it takes a pretty good lick, doesn't it?
It does take a pretty good lick.
To take both of them.
Mm-hmm.
Now, is that pretty serious? Or is that fairly average?
I mean, it's a serious injury requiring operation, but it's an injury that can be recovered from.
Now, most times when you have that kind of injury and a bone breaks, you're just knitting it. Is that the right word? I don't even know. You're sticking it back. It's the best word I can. You're sticking it back together.
Yeah, you're placing it back together so they can heal in the proper alignment.
Right.
And then using typically metal plates and screws to hold it internally.
That's always been so amazing to me. You hear about these people that get all these screws and these metal plates and stuff. That's got to be tough, Doc. I mean, just to put basic screws in a bone. They
do pretty well. It works. It's considered an internal splint. Instead of using a cast, you put plates inside on the bone and with screws, and it holds it very well while it heals. And once the bone's healed, typically you don't need the plates and screws anymore, but for the most part, we'll leave them in the body.
So just leave them in there? Or you could go and take them out?
You can take them out,
yeah.
Yes.
Okay. Yeah. So for the rest of my life, I would have that in my body if I had that done, and no problem at all.
Most of the time, no problem at all. That's correct.
Even on a rainy day.
Even on a rainy day.
Now, what kind of material is that made out of?
There's two types. One's a stainless steel, and the other's a titanium.
So is one better than the other? Depends upon the break or the injury?
Not necessarily. The titanium is more compatible if you need to do some special imaging studies later, like an MRI scan. Mm-hmm. But the stainless steel works fine.
Wow. Come a long way, because I mean, wasn't too long ago they didn't have any of that stuff, did they?
That's right. No, we've come a long way
on that end of it. Now, your specialty is the hand.
That's correct.
Why?
That's just something I like. It's very intricate and interesting.
Usually, when you're dealing, especially with athletes and/or entertainers, especially entertainers here in Music City, you know, if it's instrument players, that's their livelihood.
It is.
And obviously for an athlete with a hand, the same thing. For a surgeon, I mean, you've got a hand problem.
Very important.
And you're in trouble.
That's correct.
And so hopefully that never happens to you.
Thank you.
But in any event, I would think the hand would be interesting as well. Let's talk about Albert Haynesworth for a moment. We know that he went down against the Texans in that bad angle that we saw on TV. Wasn't as bad as Joe Theismann. Remember Joe Theismann? Remember that bad break that we all watched on television? I mean, that leg just bent, 90 degrees. That was the worst thing I've ever seen on TV. Albert's leg wasn't like that, but still he has a sprained knee.
He does.
What are we saying when we say sprained knee?
That's kind of a catch-all phrase for when you injure your knee. For what I'm hearing, it's a sprained MCL, and that's the inside of the knee.
Now, is that good news or bad news? Could it be on the outside? If it was the outside, which is better?
Well, it depends on the severity of the sprain, Hope, and I don't know the severity, but If it's a mild sprain, that's good news. Then and from what they're saying, he'll be back by the playoffs. So I suspect it's a mild sprain, but that's speculation.
And so, if it's not too bad, then he, in fact, will be able to come back in 2 to 3 weeks.
That's correct. Yeah.
With a lot of rehab.
Yes.
Yeah. So you got to do that, and in the right frame of mind too. But you know, he's a Pro Bowler. He's an All-Pro. He's got a lot of money sitting out there on the table. He's going to be a free agent end of the year. A lot of things going on here. So we know that this guy is going to get his mind right when it comes to trying to, you know, be in the right frame of mind to heal this thing and get back on the playing field.
Yeah, he'll be wanting to play, I'm sure.
No question about that. But we're coming into the kind of season too, Doctor, for the everyday layman person out there, for us, you know, when there's ice and slick spots and people fall and we have wrecks and minor wrecks, then your doors are wide open and folks are walking in every day with some kind of injury.
That's correct. The winter brings us injuries that we typically don't see in the spring and the fall as much. For what I do, people fall and slip on the ice and break their wrists a lot. Quite commonly, so we see a lot of that increase in these stormy nights, cold, stormy nights.
Breaking the hands is not a good thing because we all have to use that in some form, some way. But it's amazing what you learn to do and how you learn to compensate during this period of recovery.
That's correct.
Be it a knee, because I had knee surgery, so I know about that. And a hand, you just have to learn to do things with that other hand that you normally wouldn't do. And so, but that's just the way it goes.
Yeah, you also learn how good you had it when you had two good working hands or two good working knees. You take for granted the things you have. So.
Yeah, I know. And I know too, Tom, and talking with the other physicians that we've had on, your patients, you know, different people have different thresholds of pain, don't they?
That is absolutely correct, Hope.
I mean, some big old guys who you would think, oh man, this guy can take it. He's the biggest wimp in the world. And a little bitty guy or a lady or something who you would think, oh, we gotta help her. Boy, they're just tough as nails.
We say the bigger they are, the harder they fall. So absolutely.
Yep. And you can't. But as a physician, you also, I would think it would be important for you to know, or at least kind of have some kind of idea about this patient that you're about to operate on, what kind of threshold they have.
You do. You
and
try.
How would you determine that? Stick a pin in them and say, does that hurt?
Yeah, that's probably not a great idea, but that may work. You just talk to them for a while and you kind of get a history, see if they've had surgery in the past and see how they've tolerated pain. And then you keep a close eye on them after their surgery to see how they're doing. So, and you're right, pain is a variable response.
Sure, yeah.
And so everybody deals with it differently.
Can somebody learn to have a high pain threshold? Can you learn that, do you think?
I think you can probably learn it, maybe with some psychotherapy. But I think, you know, pain, I say, is in the mind. So how you perceive it is how you deal with it.
And I think if you're a person that has pain in a certain area, and you have it for a long time, you just kind of learn to deal with it, and all of a sudden that threshold is a lot higher than when you first began to have it, I would think.
That's correct. And
athletes too. I mean, some athletes can take it better than others.
Yes, no doubt.
Just because you're an athlete doesn't mean that you're going to be a big boy.
That's correct. And you know, we kind of say there's not many people that walk around life without pain.
True. Dr. Tom Dovan is brought to us by Baptist Sports Medicine. Now, we talked about Eric Berry, fine sophomore All-American at the University of Tennessee, safety, and he had shoulder surgery. You've done a few of those in your day, I'm quite sure. Now, we don't know the extent of this. I know that he played with that problem during the season, and I guess you can do that to a point, can't you?
That's correct. And it depends on the problem. I don't know the details of this problem. I suspect it was probably an instability problem. So you can play with that to a certain extent, depending on the degree of the instability. And
I would think, too, or I guess, Doctor, that there would be, if you play for a college team or a pro team, is there some kind of padding or something you might do for the shoulder and say, okay, kid, we're going to take care of this at the end of the year. You only got 2 more games. Here's what we're going to do. I know you do ribs that way. You just tape ribs. That's about all you can do for a rib.
I think you can pad it and tape it and maybe help it somewhat. I think you're not going to be able to hold it in, but and that's kind of some of the philosophy in sports medicine is, you know, do what we can to get you through the season. Provided you're not going to do any serious damage, and then take care of it at the end of the season.
Yeah, right. Well, Doc, it's been a pleasure talking with you. I know that you are ready, willing, and able to help whomever may walk through your door. And if it's a hand problem, Dr. Tom Dovan from Baptist Sports Medicine is the man you need to see. Thank you, sir.
Thank you, Hope. Appreciate it.
Appreciate the information. We will continue on this Tuesday night on Titans Tuesday, everybody, right after this.
Titans Tuesday, brought to you by Baptist Sports Medicine.
It's time to put an end to living on the sideline. With joint replacement, the experts at St. Thomas Health Services can get armchair athletes into the game.
Honey, what are you doing? Please don't do this to me.
Life isn't a spectator sport, so jump back in. Visit sths.com.